Welcome back to On the Beat, everybody. I'm your host, Rachel Hurt, and today we have in the studio Dr. Bethany Harston from Vitality Dermatology. And today we're going to be talking about some of my favorite things, anti-aging and aesthetic treatment. Thanks for coming back to see me.
It's good to see you.
It's always good to see you. Okay, you have brought a lot of stuff, and I cannot wait to talk about all the things. But my first question, as an aging adult in today's world, what is the best cosmetic treatment plan for someone who's interested in anti-aging?
There's so many options out there, Rachel, and I would say the best treatment for someone is one that meets their expectations. We all have different goals, and so I would say a consultation is where I typically start to try to determine exactly what a patient is looking for.
And how would you choose?
Well, skincare is always important. We have so many anti-aging and preventative skincare options, and so I typically will start with that. I want a person doing a good home program really before we do treatments in the office, and so that's the foundation. And then we have fillers. I brought 11 different ones. I have Neurotoxin, Botox and Dysport are the brands that I use. We have a laser suite at our clinic, and we also do facials and hydrofacial and lots of fun things. And so a person can really get confused looking at the menu, which is why we think a consultation, talking to us, trying to meet their goals is a very important place to get started.
Absolutely, because there are a lot of choices, and you know, not being totally savvy in the dermatology field, because how does one determine the difference between Botox versus fillers? I mean, because I might assume they're very much the same, but I'm assuming they have different functions and purposes.
Yes, and so the neurotoxins, Botox and Dysport are the ones that I use. Those are really used to reduce lines of facial expression.
Okay.
And so the most common areas that I would treat would be the forehead lines, the frown lines in the center, crow's feet. This is an example of Botox. It comes in a 100-unit vial, and the needle we use is very small. It's actually a little insulin syringe, and so it's not as scary as people think. We always use lidocaine gel if the patient desires. I brought some examples of my lidocaines. It makes the procedure much more comfortable.
Okay.
And so typically it's done for cosmetic reasons, but I recently had an interesting patient who had a Bell's palsy, therefore had weakness on one side of her face.
Right.
And I was able to treat the side that had normal strength to give her a more symmetrical look.
That's wonderful. Well, what about fillers? What's their purpose?
So fillers basically fill. They are volumizers. I have 11 different ones, and so a person may come to the office and say, I want filler, and I have to make the decision on which one is going to be the best for their particular needs. And so I would choose one particular filler if I was augmenting the lip. I might choose a different one for cheek. Or the nasolabial lines that we treat quite frequently. And again, mainly for cosmetic reasons, but I've also done some corrective restorative work with my fillers. Recently treated a cleft lip and was able to correct a person who'd had a cleft lip for 30 years, really got a nice symmetrical lip. We were really happy with that.
I bet.
Also recently had a patient with a skin cancer surgery who was not happy with the scar on her face, and I was able to fill around the scar and contour so that she had a more symmetrical look.
Oh, that's wonderful.
Yeah.
Well, it's good to know that these are, not only do they make us feel better about ourselves, but there's also a medicinal side to it to help those people as well.
Yes.
I guess the bottom line is we all need to call to schedule our consult so we can see what's right for us, right?
Yes, that's the
Thank
first
you so
step.
much for coming in today.
Thanks, Rachel.
I can't wait to pick up the phone when I get out of the studio. Everything you need to know on how you can get in touch with Dr. Harston and her staff at Vitality Dermatology is on the screen. Give them a call and see what is the best treatment plan for you. We'll be back right after this.